Thoughtful evening to one and all who are all gathered here. Excellence is not being the best, it is doing your best. Now, it's my pleasant duty to bid you all a genial welcome for this webinar program by our resource person, Dr. Joe Louis Paul, regarding the topic the role of Internet of Things in current pandemic of COVID-19. Now, I would like to call upon Ms. Keertika from 3rd ECE to deliver welcome speech.
A warm good evening to all. Do not wait for tomorrow because tomorrow does not wait for you. Therefore, tomorrow always comes tomorrow. It's pleasure to start this auspicious occasion by heartily welcoming everybody. I heartily welcome our Honorable Secretary Sir, our Vice Principal Ma'am, and Principal Ma'am and Vice Principal Sir. Surround yourself with the dreamer and the doers, the believer and thinker, but most of all, surround yourself with those who see greatness within you, even when you do not see it yourself. And a very warm welcome to our resource person, Dr. Joe Louis Paul Sir. Last but not the least, I extend my welcome to various department HODs, teaching and staff, and my dear participant from other college. Today, we are gathered here for the one-day webinar on the role of Internet of Things in current pandemic of COVID-19. So once again, I welcome you all for the wonderful occasion.
Thank you, Kirtika. Every nation has a message to deliver, a mission to fulfill, a destiny to reach. The mission of India has been to guide humanity. Words from Swami Vivekananda. Likewise, we are blessed to have our honorable chief guest, Dr. Joe Louis Paul, for this wonderful session. And now, I would like to welcome our assistant professor, Mr. Newton David Raj sir, from ECE department to share some few words about our resource person.
Good afternoon to all. It gives me great pleasure to introduce the resource person of this webinar on the role of Internet of Things in current pandemic of COVID-19. We are honored this afternoon by the presence of the Honorable Resource Person Dr. I. Joe Louis Paul. Dr. I. Joe Louis Paul has more than 22 years of teaching experience and 14 years of research experience. He received his BE degree in Electrical and Electronics Engineering with a first class from Karunya Institute of Technology, Coimbatore, ME degree in Computer Science Engineering with a first class with a distinction from MEPCO Shillong Engineering College, Sivakasi, and a PhD from Anna University, Chennai, in the area of error control coding. He started his career as a lecturer in the department of EEE Allahabad Chettiar Government College of Engineering and Technology, Karaikudi, in the year 1998. After earning his master's, he joined as a lecturer in the Department of IT, MEPCO Shillong Engineering College, Sivakasi, in the year 2002. After then, he joined SSN College of Engineering in the year 2005, and he is currently working as an associate professor in the Department of IT, SSN College of Engineering. He has organized and attended many externally, internally funded conferences, workshops, seminars, guest lectures at a national and international level. His current research area of interest include Internet of Things and machine learning. He has guided about 70 UG projects and 14 PG projects so far. He is an active member of various professional bodies including ACM, IEEE, ISTE, IETE, and CSI. He is also an active reviewer for reputed publishers like IEEE, IET, and Springer. He is also serving as the technical program committee member in various national and international conferences. He is a recognized coach for the ACM International Collegiate Programming Contest, that is ACM ICPC, from 2006 onwards. He is also a recognized faculty by National Entrepreneurship Network (NEN) for teaching entrepreneurship in any recognized member institutions across the country. He has published more than 30 technical papers, including referred journals, national and international conferences. He has received the SSN Best Teacher Awards for the academic years 2005 to 6, 6 to 7, 7 to 8, 9 to 10, 10 to 11, 11 to 12, 12 to 13, 15 to 16, and 18 to 19 to his credit. He has received three Best Paper awards for his research papers presented in IEEE sponsored international conferences. He has received Best Poster Award in international conferences organized by Department of IST College of Engineering, Gindi, Anna University, Chennai. He has received Best Project Award in the international conference organized by Department of CSE, SSN College of Engineering, Chennai. He has already completed a project worth of rupees 3.05 lakh for the project on disaster management next generation as the principal investigator under the faculty internal funded project scheme initiated by SSN Management. He has also received the amount of rupees 3 lakh as the co-investigator for the ongoing project on SSN Indoor Navigation System from SSN Management. Two projects which are submitted for external funding agencies, Government of India and Government of Tamil Nadu respectively, are in under review. In the last 2 years, 10 students projects guided by him have been funded by SSN Management. Along with his colleagues and students, he filed a patent titled on real-time drowsiness and fatigue detection for bikers using helmet on March 15, 2020. This is what about a small introduction of our great resource person, Dr. I. Joe Louis Paul. Yes, really, he is man of awards, man of development, man of wisdom. We are very, very delighted to have you as our resource person, sir. Thank you, sir.
Yeah, thank you, sir.
Yes,
Shall we
sir. I
start?
hand over now. Yes, sir. Yes, sir. I hand over the session to our resource person. Yes,
Yeah,
sir. Okay, sir. You
yeah,
proceed, sir.
yeah. So is the screen is visible?
Yes, sir.
Yes, sir. Yes, sir. Yes, sir.
Yeah.
Visible, sir.
Okay. So very good afternoon to all. I'm very much thankful to the students. Okay. So who have coordinated for this webinar. Am I right? So I really congratulate them. And also I would like to thank for the detailed introduction given by Mr. Newton David Rath, sir. Thank you so much, sir. So let me start my presentation now. The title I have given, The Role of Internet of Things, IoT, in current pandemic of COVID-19. So myself is Joe from SSN College of Engineering. So the flow of my talk is like this. I'm going to briefly give an overview of COVID-19. And before I start talking about the IoT, I feel that it would be better if I introduce something called as the digital transformation, where I want to talk about artificial intelligence, blockchain technology, Internet of Things. And I have a special thing with you to be shared, that is FSAI support to fight COVID-19. What are the possible solutions are provided or manufactured in India itself? That is Fire and Safety Association of India. And finally, I want to give the definition and so on, called as Internet of Things, only at later point of time. I feel that for students community and the faculty who are doing research, I feel that Industry 4.0 I would like to address at the end of the talk. Even after Industry 4.0, I have few slides which would be very much useful to you, but I didn't put it here. Let it be a surprise at the end. Okay, so this is the flow. So let us start with the brief overview about COVID-19. So the title is given, The Role of Internet of Things in Current Pandemic of COVID-19. In this picture, you can find, and the COVID virus is there at the center, even buildings are there, so many things. Okay, it conveys the title, okay, the role of IoT in this outbreak, okay, COVID-19. So this is only the picture, okay, how we are going to relate the IoT with COVID-19 virus. But anyway, my talk starts from here. Okay, so I already told you there in the flow, I'm going to give you the brief overview of COVID-19, even though we are familiar. Okay, so if you ask anyone in the world, okay, what is the most commonly heard word, okay, if you ask, not only today, for the past 17 months, this COVID-19 is the commonly heard word. We all know that it was discovered first in the early December 2019, okay, in the city called as the Wuhan in China. That is, it comes under the Hubei province of China. Like Tamil Nadu, we have states, okay, it comes under the Hubei province of China. So when it was discovered in the early December 2019, it was named as 2019 NCOV by China there itself. So where here N stands for the novel coronavirus, because it was discovered in the late 2019, the year was coming here. But later point of time, we found that the World Health Organization, who declared this outbreak as a public health emergency of international concern on the last year, January 30, 2020. So meanwhile, we have a big committee in the world that is called as the International Committee on Taxonomy of Viruses. This committee, it's an international committee who is responsible for naming the viruses actually. So they have announced, they have given a new name for this virus, okay, because temporarily China has given some name, but they have given a universal name for this virus that is called as the SARS-CoV-2. That is what they have given. That is severe acute respiratory syndrome coronavirus 2 as the name of the new virus. They have announced this virus name in last year, February 11, followed by WHO in the same date, same year in the last. And they have given the disease name as the COVID-19. That is the title for this first slide, that is coronavirus disease 2019. So somebody is announcing the name of the virus, somebody is announcing the name of this new disease, and finally you can find who was declaring this COVID-19, that is coronavirus disease 2019, as a global pandemic in March 11, 2020. So I took this title because we are familiar, but we have certain things to learn, okay, how the Internet of Things and digital transformation are going to do. So here you can find he's very famous person today in the entire world, and you will wonder that he is none other than Dr. Tedros Adhanom Ghebreyesus. Okay, it's very popular name in the entire universe because he's the Director General of World Health Organization from the year 2017, May 23rd. He announced one statement in a press meet, and he said that COVID-19 is the public enemy number one for the entire world. Yeah, of course, but I would like to convey something about him. And he is the very first person taking the role as the chief of WHO from an African country. He's actually from Ethiopia, and African country. He's non-physician for the first time heading WHO. He's actually a microbiologist, and he has made a lot of research. He's very popular in the world because of his research on malaria, and internationally he's very popular, and he was elected as the Director General for WHO in the year 2017. So very first person, non-physician. He's not a doctor, but he's doctor in microbiology, like us, okay? He's a researcher actually, a non-physician, and an African person is representing the WHO. That is really an interesting one. But what he made to the entire world, saying that COVID-19 is the public enemy number one for the world. I feel that this will be the right thing to be shared with you. Okay, so COVID-19 is concerned, we have a popular dashboard which is updated every two hours, okay, by the very famous university called as the John Hopkins University, JHU. And I should share something about this university. This university is actually a medical university, and found in late 1800s. This is the world's first research university, I could say. Okay, so they have a center in that university that is called as the CSSE. That's very popular center that is called as the Center for System Science and Engineering, and where they are updating the COVID-19 dashboard was created by this CSSE from JHU, a medical university. Here we can find that we are just behind um, from United States. In the left hand side, you can find the red color. US is there, the first count, then India and Brazil, France, and so on. This is the current state. I have taken this picture in today 10:50 a.m. Okay, and it says that India is concerned, we are just behind, fall behind of United States, and you can find how much count is there, how much is the death, and so on. The figure is saying clearly, okay, why it is called as the public enemy number one by the WHO Director General. Uh, that is what it's justifying. Even the same university, they have come up with India's COVID figures. This is updated on 2nd May, but they are predicting about after March what will happen to the cases and so on. And you can find the number of cases and number of deaths. There are two graphs are there. The first one is cases, okay, and how it moves across the month, okay, June, September, December of 2019, and March, April, May, and so on. And that is the data, okay, and they are predicting that deaths on 17th June in the coming in the next month, okay, and how it could be. That is what the same university, okay, JHU, they're able to predict. Even they have come up with state-wise COVID-19 new cases. Okay, I have just taken Tamil Nadu. You can find JHU CSSE COVID-19 data. Okay, last updated 2 days ago, and up to 25th, I have given the new cases for our Tamil Nadu. It's big worry for the entire state. It crossed already 35,000. Okay, we are hearing the news saying that Coimbatore is crossing Chennai. Okay, in the new cases. That is the big worry, okay? So, but anyway, people are saying that for the past 2 days, okay, Chennai new cases are getting little bit reduced, okay? But Coimbatore, it starts increasing than Chennai. That is what we are hearing. Okay, so this is the death, okay, we are finding in Tamil Nadu, in India, okay? The 7-day average, okay, from the last thing you can find, it's coming around 424, okay? As I told you when I started my presentation, okay, the most heard word in entire globe, even today, it's going to be COVID-19. But today people are talking about something that is called as the double mutant variant of coronavirus. And I feel that I should discuss in overview of COVID-19. So India is concerned, we are facing a lot of issues due to COVID-19. Irrespective of the central government and state government initiatives and all other supports, okay, this is only because of this double mutant variant spread in India that is called as the B.1.617. That is the variant we are talking about in India. So when you think about coronavirus, I feel that we should be very clear about mutation, because in the previous slide, I was talking about the double mutant. That is what the biggest worry in the entire nation. So mutation is nothing but there is a change in the virus genetic sequence. And it is, of course, it's very common for any virus is concerned. So the genetic sequence of the original SARS-CoV-2, that is COVID-19 disease, okay, that has been changed. Okay, that is obvious. And moreover, you can find, we are talking about the variant. Variant is nothing but a virus whose genetic sequence differs from its parent virus. And this is what we are talking about. Okay, double mutant variant. That is what people are telling about the virus which is spreading in India and other neighboring countries. Okay, we have certain strain, which is the common term which is used, a variant with many mutations, and that significantly alter its behavior. That is called as the strain. So we should be very clear with the double mutant virus in India and the variant, what is exactly mutation, the change in virus genetic sequence. So according to the Hindustan Times, okay, in the top right corner, Hindustan Times have, even I have given the source at the bottom of the slide, where you can find that B.167, okay, 1.617 spreads, how it's happening across the country. You can find Southern America and most of the African countries, okay, the Gulf countries, Russia, China, India is in very dead condition here because we are able to find out 1,873 sequences of this virus variant, that is B.1.617. Actually, we have three variants, okay? B.1.617.1, 0.2, 0.3. The sequences in India for all the variants, you can find the first one is 1,102, 272, then 50, 543, and 58. And what are the key mutations happen in the parent virus? That is also mentioned here. And in the right hand side, you can find 2/3 share. It's happening only in India. 38.9% B.1.617.2. That is the what is that, the spread of that particular variant. But in that totally we can say 2/3 of share it's happening in India. That is the very bad news for each and every one of us. Okay, all types of variants are found in India, and you can find which variant, that is the first variant, is making a lot of damage. And see the color in the entire globe, you can find, except in UK and a small portion of the UK, and we can find only in India we have found so much of sequences which are spreading like anything in the second wave. That is what people are talking about, corona second wave. That is nothing but B.1.617. okay, that is double mutant virus we are talking about. So we all very well know that how the transmission of COVID-19, the virus is coming up. Okay, in the right hand side, somebody's lungs, you can find some viruses over there. Okay, and there is a process called as the human automation, and where during sneezing or cough or touching something, the viruses are coming up. Maybe through coughing, the droplets are coming out. The droplets, the size is very high, and therefore they cannot travel through the air. So they are trying to find out and settle in some contact transmission. Contact transmission may be your chair where you are sitting, or any other objects nearby. Okay, so those droplets will settle down, and that may indirectly contact with other persons in the home or in the classroom, wherever we are in meeting. And that is a problem with droplets. Okay, it can indirectly or directly affect. Okay, so otherwise these droplets may be going through our nose, okay, through breathe. Maybe I'm sitting with that person, let us assume, and that is the case. And aerosols, that is a small in particle which are capable of traveling over the air. Over a certain period of time, they can be alive and aerosols, and they are reaching some other person through the air, okay, the medium. And that kind of transmission, according to medical world, we are calling it as the airborne transmission. He may be a person who is in your street or next apartment or in the same apartment, and so on. So this is the way the transmission of COVID-19 is actually happening. And I just want to share something what is happening around India. Okay, so recently Indian coronavirus, Indian variant, this is what kind of messages have been shared in social media. You might have seen in YouTube or WhatsApp or Facebook or Twitter. Those social media, you can find Indian variant. That is what I shared. But anyway, it was represented by the Ministry of Family and Health Welfare, Central Government of India, and with the proper representation in the May 10, almost 17 days before, and who classified that and announced that B.1.6, that is B.1.617 coronavirus variant first found in India in last October. It's no more going to be called as the variant of interest. Now it is being called as the variant of concern. Okay, so who never mentioned the name Indian variant? But anyway, in social media, it has been spreaded across the globe. Okay, Indian variant, especially found first time in last October 2020. So with respect to this message, what Indian government has taken, okay, so government writes to Twitter, Facebook, and Google, asking them to remove all the content that contains the names called Indian variant of COVID-19 or Indian variant of coronavirus from the platform immediately that was given, okay, to all the social medias, and it has been done May 21st, almost 6 days before this was written by central government, especially Ministry of Health and Family Welfare. And so now we have to understand, I think with that I'm going to close the brief overview of COVID-19, and this is the last slide for this first part of my presentation here. So we have to be clear with what is meant by variant of concern, okay? Variant of concern, that is what who has announced about Indian variant with variant of concern. They removed, they have clarified. So variant of concern is very something different. It says that it is more dangerous than the original form of the coronavirus found in the late December 2019 in China. And what do you mean by most dangerous here? It says that higher transmissibility. That is the problem. It can transmit through the air over distance. And lethality is nothing but death rate is very high. Okay, variant of concern. In our local terms, we are calling it as the corona wave 2. Okay, corona wave 2, but here it is variant of concern. And who also clubbed the Indian variant with Brazilian British. British has its own variant called as the B.1.1.7. Okay, and South African mutations are being put together called as the variant of concern. So variant of concern means most dangerous than the original virus and more death rate, resistance to vaccines. Okay, even though people are saying that COVID vaccines like Covaxin or Covishield, they can fight against this variant of concern, okay, the double mutant virus. Let's see. So this is the brief introduction to our presentation. Okay, now we are moving on to the digital transformation. So, okay, we all learned that COVID-19 will be with us for a longer period of time. That is what our learning from the last year to till now, May 2021. So, hygienic, we have to adapt some social norms. Okay, we should not go and attend the large gatherings, functions, meetings, and so on. So, everything should be in online if it is necessary, and physical or social distance we have to maintain. We know, because the learning from this, it is going to be with us for a longer period of time. I think I found some famous memes or cartoons, okay, in the famous United States New York Times. Okay, even some of you might have watched the recent IPL 2021 matches, okay, due to COVID spread among the players, especially Kolkata Knight Riders and CSK officials. Okay, so we found in the news, okay, it has been postponed, and we are hearing the news, okay, whether it would happen in United Arab Emirates, okay, like in the previous years. So now you can find this elbow bumps, okay, the captains or the players, they normally used to have the elbow bumps. Yeah. Okay, and how the distance is going to be. Okay, if it is so urgent, let us have the video chat, and we have instant messaging. Okay, no face-to-face meeting. That is what at the last cartoon you can find. And let us all keep the distance in the right hand side. They're all the popular cartoons, okay, keeping a safe distance, a how to guide, which was published in New York Times, okay, very famous there. And you can find a small hotel where, or small maze or whatever you call, okay, a red line on a chair, okay, that indicates that a distance should be followed. Now I am moving on to the part 2 of my presentation, which is talking about digital transformation in health and social care. So I will, before I talk about IoT, okay, I feel that I should talk about digital transformation in health and social care. Therefore, I introduce the second part of my talk here. So digital transformation, people are thinking that it's just a disrupt technology, but it's not so. It says that finding out or coming up with a new strategies and new ways of
Sir,
a longer period of
sir,
time. Yeah.
part 2 slide share பண்ணுங்க sir.
No,
Slide,
it
part 2
is
slide.
being continued from this.
Okay sir.
Yeah. I didn't have three
Slide
presentation.
movement.
Yeah,
Okay
this
sir.
is the slide I'm currently talking about. Is it visible, sir?
Okay. Is it visible? But movement is off, sir.
No, I didn't move anything. Is it moving?
Okay. No sir, no sir.
Please check, sir.
Is
Are
it
you able
fixed one, sir? Yes, sir.
No. Are you able to see the child
Yes,
face?
sir. Yes, sir.
Okay, it is
Child
moving.
first slide is in. Yes, sir.
Yeah. So digital transformation is nothing but finding out the new ways. You can find in the left hand side diagram. Innovation is there, data is there, competition is there, value is there, and we'll quickly understand what is mean by digital transformation. Traditional thermometer we all used once upon a time, and now in a college or organization we have um, thermometer, digital thermometer. But what is digital transformation is, it's not digital thermometer, but it's something else. Thermometer with monitoring value. When a kid is sleeping on the bed, okay, we have to monitor continuously. You can find 102.1 degree Fahrenheit, okay, so something like that. They have given some example. So what is exactly digital transformation? And since we are talking about IT, and I felt that we have to compare IT with digital transformation. So IT transformation is mainly centered around on the technology, okay, the technical skills, something like that. So the focus is only on the technology, that is called IT transformation, whereas the digital transformation is mainly focused or centered around on the user. That is exactly digital transformation. But anyway, the backbone of the digital transformation, I can say that it is IT transformation is also there with digital transformation, but they are not the one, they are not the same thing. So one is centered on the user, but users IT transformation, but IT transformation is mainly trying to understand the technology, the skills, the organization, something like that. Okay, so that is what happening in IT transformation. Okay, so therefore here I have mentioned that IT transformation precedes the digital transformation. Okay, so this is the roadmap we have to understand about the digital transformation today. If you have been asked to involve in digital transformation, first you should know your organization. Okay, what is the value of the
Excuse me,
organization?
sir.
What is the existing? I'm sorry. Yeah,
Sir,
yeah.
slide is not changing.
Here it is changing.
Sir, slide share
Maybe
கொடுக்கிறதுக்கு முன்னாடியே first slideல நிக்குது sir.
no slide has changed.
So now only changes.
I'm sorry.
Yes sir, இப்போ
Yes, sir.
22nd slide visible ஆகுது sir.
Okay.
Okay, you didn't see other slides.
Now only
The,
visible sir.
okay, maybe I can maximize. Okay, I can maximize the screen. What about previous slides, the 10, 11, 12? Are you able to see that or not?
No sir.
No, maybe I'll just quickly run out, okay, whatever I discussed about it, okay. Is it visible now? Yeah, is it visible?
Yes sir.
Yeah, this is the flow I was talking about. Yeah, this is the flow I was talking about. This is my first slide, and this is what I have explained to you, okay, regarding the COVID. Okay, I have explained to you, and this is what I discussed about you. I hope you didn't see all the slides. Yes?
We didn't sir.
Okay, I'm sorry for that. I think you might have informed earlier. Okay, fine. So this is about, I talked about the coronavirus disease, okay, the history of it, and how he called public enemy number one. And this is a slide from John Hopkins University. And this is the India's COVID figures and COVID new cases in state-wise Tamil Nadu, and death cases and double mutant. This is what I was talking about, mutation and variant, okay, changes in the virus genetic sequence. And variant is virus whose genetic sequence differs from its parent. And this is what I talked about, the footprint of B.1.617, okay, how it occurs. India is in very danger condition here. And transmission of COVID-19, how it is happening. And then how coronavirus has been declared as the variant of concern from variant of interest. How government of India asked the social media platforms to change or remove the content with names Indian variant from WhatsApp, Twitter, Facebook, and other Google, YouTubes, and so on. And I just explained what is meant by variant of concern and what we are supposed to do, because it's going to be with us for a longer time. And this is the meme I have shared with you. Maybe I'll stop sharing, okay, with this concept. I was talking about digital transformation. And are you able to see all the slides? Because I just running
Now
out because
visible,
that,
sir.
yeah. And this is what I talked about, digital transformation in health and social care. Okay. And now we are in IT transformation, which is centered around IT, that is the technology, whereas a digital transformation is mainly centered around your user. That is what digital transformation map. I think here I was talking about digital transformation map. Maybe I can stop sharing and I'll just share my screen in full screen mode. Okay, that will be easy for me. Just a minute, please wait. Okay, I just stopped sharing the screen and please wait for a while. Okay. Whether all slides are moving? Now you please tell me.
Yes, sir.
Yeah, thank you.
Sir.
Yeah. So this is what I have discussed with you. Double mutant virus footprint, how COVID-19 is actually getting transmitted, droplets and aerosols, airborne transmission. Who announced that Indian virus, no more it's going to be called as the variant of interest. It's going to be variant of concern. How government of India has taken the step for that. What is exactly variant of concern? What we are supposed to do, how we are actually coping up with the cartoons from New York Times, and what is digital transformation. It's not technology, it's something else. And the last one, which is talking about the real digital transformation, we are able to monitor continuously. This is IT transformation and digital transformation, and this is where we are actually. Yeah, is it going well?
Yes, sir.
Yeah, thank you. Okay, so as I told you, the roadmap for digital transformation, first we need to understand what is our organization, what are the customers or stakeholder, finance, infrastructure, and so on. We should know who are our users. We should know the technologies, what is existing, what is the current or state of our technologies, what is the strength of the organization, weakness of the organization, the economic factors which are playing the major role, that is ecosystems, and finally the opportunities or barriers and the business plan. This is called as the digital transformation roadmap. First, know your organization, know your customers, know your technology, know your ecosystems. Okay, not only organization, the surroundings of your ecosystem, and finally come up with a business plan with opportunities and barriers or obstacles, and that is. So when you think about digital transformation, there are three major areas are going to be covered. One is called as the artificial intelligence, blockchain technology, and Internet of Things. So we understood that over the 17 months, okay, it is, yes, it's very big outbreak, okay, but it's also acting as the catalyst for change. That is what we are learning from COVID-19. So first, let us take the good example for digital transformation using AI. It says that clinical information. So recently, I found that in Singapore, a AI-based startup has come up that is called as the Bot MD. A startup AI based on AI, which says that a clinical chat assistant smartphone app to help the doctors in Singapore and frontline healthcare workers getting the latest information relating to COVID-19. This is very popular in Singapore, that is Bot MD. And this app is currently being used in two important popular hospitals like National University Hospital or Tacton Sing Hospital. Okay, two popular hospitals in Singapore, they are currently using this idea. Okay, that is AI-based startup Bot MD, a clinical chat assistant to help the doctors and the workers to get the latest information about the COVID-19. So since we are talking about the examples for digital transformation, okay, which is centered around the user, we have something called as the precision diagnostics. Okay, we know Philips, which once it was very popular for radios. Okay, now also, okay, it is very popular company. And Shukan Technology, very popular company in China, they have come up with a AI-based algorithm. Okay, so given a CT scan image, okay, what are the affected regions in the lungs that can be characterized quickly by using this AI-based algorithm. That algorithm, we used to call it as the clinical decision support algorithm, CDS algorithm. And Sukan Technology and Philips in China, they have come up with this algorithm. And moreover, if patients are isolated in hospitals, let us say, and when they can be discharged after the successful treatment, and that can also be decided with the help of AI with precision diagnostics. So we have drugs discovery also. Okay, in United Kingdom we have Benevolent AI, which is a startup company, and they're very popular in United Kingdom. It's a London-based company, and it says that AI-based drug discovery platform. Okay, given a patient's information, initial stage or something like that of COVID-19 patients, how will you identify the drugs? Okay, so that you can save the life of the people at the earliest, identifying the stages, okay, of the corona patients. And Google, they have come up with, I think it's not originally, it was something, a different company, Alpha Inc. or something. Okay, and I think in 2014, Google has acquired this company, DeepMind of Google, that is DMG. It's also a AI-based company. And there are so many options are there with DeepMind. We have WaveNet, which is very popular. The most popular text-to-speech translation. Okay, we have something called as the WaveNet is there. Then Wave Wave RNN. These are the things are also there. StarCraft, Google Assistant for consumer applications. There are so many Google products which are available along with DeepMind. They are very much helpful for COVID-19. Okay, so now we are moving on to the second example, which is blockchain technology for digital transformation, which is centered around the users. So in the right hand side figure, you can find the real-time patient health data is available, but it's not transmitted to the care team, the healthcare team. It is available, but is not transmitted to the healthcare team. Whereas in the right hand side, electronic healthcare record of patients is available, but it does not reach the patients. So this is the gap is actually found, and it has been addressed by blockchain technology, and which helps us to maintain an electronic health record, okay, digital copy of an individual patient's medical history, and proper authentication should be given, okay, so that who can access this data, what changes you make, it should be visible to others, and so on. And blockchain is playing a major role in maintaining the electronics health record for this particular period, and it is also very much used with supply chain. For example, the vaccines or the drugs which are being transmitted from Pune or Hyderabad to our state, okay, every drug can be tagged with the barcodes or RFID, and we must understand that how it is transported. You can track, okay, all these things, okay, the drug delivery system with the help of supply chain management, okay, we can get the updates, okay, in real time. The drug is transferred from one place to another place, something like that, and who can check all these records, whether the patients or authorized parties can check the records at any time. Okay, so now we are moving on to Internet of Things. Okay, I didn't define here, quickly I will define later point of time. And this says that health monitoring, it is very much useful, and because hospital nurses need take the measurement of temperature, heart rate, blood pressure from each patient every 4 hours, but with the help of IoT, okay, a wearable device can monitor all these measurements completely, and those data can be shared to the nurses or other medical staff when abnormality is going to or happening. So this is the way you can think about health monitoring system, and accordingly, with this help of data given to the medical staff, you can personalize the treatments according to the need of the patient outcomes, okay, and that is what it's going to help out here. And I just come up with a diagram because the title is more related to IoT in current pandemic of COVID-19. Here you can find a patient's data is going to the desktop manager, doctor or physician is having medical tab, and health cloud, you are talking about where EHR, that is electronic health record, individual patient's record is there, a plus symbol is given, and wearables. Nurse is not going to make all the measurements then and there, okay, because corona case, we have to be careful, and all the clinical trials are maintained in a database. You can find biobanks clinical trials, and from the desktop manager or the server, interacting with the cloud, interacting with physician, interacting with the patient, interacting with database. This is where you can think about IoT in patient monitoring, especially during COVID-19. And just think about remote health monitoring. A old man is walking with a walking stick, and he have some variables, okay, heart rate and respiratory rate, motion in his hand and leg you can find, and with the help of Bluetooth, Zigbee or wireless local area network, that is Wi-Fi, how your cellular network, GPS, so his data can be connected with all this things, you know, so that can also be done here. Just a minute, I'll come back. Okay, I just come back, please wait. A small interruption here, just wait. Are you able to see my screen now?
Yes, sir.
Yeah,
Yes, sir.
just a minute, ma. Just a minute. So is it visible? I'm moving my slides. Yeah.
Yeah, sir.
Yeah, any difficulty or any issues, please tell me. I think we are talking about the remote health monitoring. This can also be done with the help of IoT, and people may be interested in knowing about the sensors and communication layers. We have air sensor, blood sensor, ECG, motion sensor in your hand or leg, and we have to interconnect all the set of IoT sensors, and you can think about data fusion in various contexts according to the need. And finally, we have to make some decisions there, and alerts to the nearest hospital or the ambulance, or communicate via internet with nearest doctor or nearest pharmacy. This is the way you can think about integrating sensors with communication protocols and decision making algorithms, and this is what we are talking about. Are you able to see this slide? Please tell me, because we have faced some issues. Yeah, are you able to see IoT in centralized monitoring system?
Yes, sir.
Okay, thank you. And this is what happening in most of the hospitals, okay, Stanley or any private or government hospitals. You can find there are so many beds over there, and we are finding out the temperature in degrees Celsius or Fahrenheit, and all this data has been collected in a centralized manner. And here some medical staff or physician are there. The cloud can be a local cloud belonging to the particular hospital, or it can be a global cloud, so that the information can be shared across the hospitals and the proper treatment can be given from the remote places. So this is what happening here. You can find there is an alert for a particular patient. It is in red color, which says that we have to give some attention to this particular person. That can be monitored in a centralized manner. And IoT and data analytics, which are also related, you can find the physicians, the cloud infrastructure, the symptoms data collection and uploading through an app or through a mobile app or web app. And you can think about the quarantine. It may be a home or an isolation center, maybe part of hospitals or universities or schools, and data analytics center you can find. Okay, so all these things are integrated together. So now today people are talking about contact tracing architecture. This is very interesting. Currently, this is what people are talking about. Assume that I'm an infected person of coronavirus. Okay, and what is actually going to happen? So I am living in Chennai, and in a particular place, let us say Tambaram. Okay, I'm living in this place, let us say, and I'm living in a area in a particular location, and whoever comes to my proximity of my location, they can be alerted with a message. So something like that, contact tracing. Even through my contacts, okay, the people who have interacted with me through mobile phone, they can also be alerted saying that please avoid entering into this particular street or entering into the particular malls. So something like that, contact tracing architecture, centralized and decentralized, these are the architectures are coming into the picture today, and they are in the ideal level. Okay, so products are yet to come. It is in prototype level. It is published as the research paper, okay, in International Journal of LaTeX Templates. I found that this is the new contact tracing architecture. Okay, when a person is coming to the proximity of the infected virus affected person, and they can be given in an alert. You have to think about how much close you are with a particular person. Maybe I am entering into the street at the beginning. My house may be at the end of the street. So where the alert will be given. Okay, so something like that. Contact tracing where IoT is coming into the picture, and coverage area and accuracy comparison for different sensing or infrastructures. We have Bluetooth, very accurate because a short distance communication. We have something like Wi-Fi, QR code we are already using, moderately accurate, but premises and boundaries are there, and less accurate, but 2 to 3 kilometers, that is where cellular communication. Okay, so recently I found that blockchain and IoT based solutions are coming up in the distribution of the COVID-19 vaccine. So I found something interesting in the articles, okay, related to that. They are talking about how shipping is happening. In the left hand side, you can find cooling pallet and boxes where the vaccine is there. And we have smart air cargo, okay, even Sputnik V that has come from Russia. And so you can think about smart air cargo, okay, it's not simply air cargo, okay. So then we have smart warehouse, Pune, Hyderabad, Delhi, and other locations, and then smart local transport from Pune to Chennai, and vaccine recipient, maybe in a particular hospital. So for this end-to-end smart logistic solution for COVID-19 vaccine distribution, blockchain and IoT based system is currently being used. You may not be knowing that this is entirely used. So here I have given challenges posed by temperature sensitivity. So for India is concerned, the Covaxin and Covishield, popular two vaccines, which are into the place, so their temperature is given that 2 to 8 degree Celsius. That is the temperature that can be put it in normal refrigerator. So therefore in all the hospitals they are having small boxes, okay, where their vaccines will be there. But even Sputnik V from Russia, that is also the temperature is given 2 to 8. But we have some other vaccines, okay, in the globe, that is called as the Pfizer and Moderna. These are going to operate only in, they should be cooled around -20 and -70 degrees Celsius. Imagine the problem with other countries, what they are supposed to do. Okay, so in COVID-19 vaccine distribution, temperature sensitivity is a major problem, especially for Pfizer and Moderna. Pfizer is -20 degrees Celsius cooling and temperature sensitivity, whereas for Moderna, it's coming around -70 degrees Celsius. Whereas for Covaxin, Covishield in India, and Russia's Sputnik V, it is given that 2 to 8 degrees Celsius, that is manageable to us. And here also you can find how IoT and blockchains are synchronized. We need to have raw materials for vaccine. Then we have to produce the things, and final product, the doses, then transportation, either by using smart air cargo or local transport, from cargo to local transport. Then we have to think about storage, then consumption by consumer in a particular hospital. And we should also think about after effects. In between, you can find something called as the chain. You can find some chain. Blockchain is there in between. You can find blockchain is there in the middle. Okay. So today people are talking about asset tracking and control. I think this diagram will be helpful to you, which says that many devices like oxygen cylinders and RFID, many sensors monitoring the patient's heart rate and so on. And we have a lot of Wi-Fi hotspots, access points, hub, or BLE, that is Bluetooth low energy. So many devices are there even in a single room or in a cabin or hospital. So this IoT is playing a major role today, asset tracking and control. Which device is in which location of the particular hospital, you can track. This is called asset. Every sensors, every device is connected with network having, it is an asset for us, for IoT is concerned today, for healthcare application is concerned, and they're all tracked and controlled. Who can access this device? Okay, it may be an oxygen cylinder. Only the authorized person should access this device. Okay, if somebody is doing, it may be a problem, it may affect the health or life of the person, and see how this collected with, what is that? The cloud. So briefly saying, asset tracking, control, vaccine distribution, and there are many roles, okay, coverage area and so on. That is what I think. The second part of my presentation is fully completed, digital transformation, how it really helps, okay, because it's never ending as of now. So we have to think about digital transformation, AI based app, and what is that, blockchain, and the supply chain, and so on, and IoT. Now I am coming to the third part of my presentation, that is called as the FSAA. FSAA is nothing but Fire and Security Association of India, and it's a non-for-profit organization found in India around 2002, and they are giving full support in India to fight COVID-19. They have come up with fire and security applications of India. So they have come up with simple solutions, easy to deploy, and their aim is to contain the contamination and limit the spread of COVID-19 with the help of the current technology. And the second objective, I was very happy to tell you, because whatever things they develop, they should be designed and developed by any small scale manufacturer locally in any corner of India. That is the main thing they have come up. And of course, lowest cost. These are the three objectives they have come up. And they have come up with sanitization chamber in the last year. Salem, Tirupur, Coimbatore, I have seen these kind of sanitization chamber. People will be allowed to enter into this chamber, and it should be a protected premises, hospitals or R&D, government office, and market, Sunday market in those areas, especially in Salem, Tirupur, Coimbatore. This idea was used. They have come up with sanitization chamber, and you have to walk through, okay, and you have to walk slowly. And we will be having some walls that will be spray some sanitization. That is what happening. And we have some major components. What is the cost? And that is explained by FSAI. But here, very much interesting or very important thing is we have to consult with the proper health expert. Okay, what kind of solution you're going to use for disinfectant? That is diluted hypochlorous oxide or alcohol phase disinfectant, normally used in this kind of sanitization chamber. Care must be taken, okay, because it should not be high. We have to be very much careful because you are allowing the people to walk very slowly. And same Fire and Security Association of India, they have come up with trolley mounted spray system, especially for floors, premises, building, offices, laboratories, something, office premises, government offices, something like that. Trolley mounted spray system, all these things are available in the market. The price is also given. Trolley mounted spray system. Okay, I'm just going through. This is a skid mounted spray system. Okay, this is what in municipal corporations we might have seen. Okay, this skid mounted spray system in Chennai Greater Corporation. And what are the components are involved? What is the typical cost for this sanitization solutions from FSAI? And we have backpack spray system, which is normally used in the street side or in the college premises. This kind of portable backpack spray system in the classrooms or in the corridors you might have seen. Okay, even near the malls, near the pathway, on the roads, you can find these kind of systems. But we have to be careful because the person who is going to use this device or equipment, they have to come up with personal protective equipment. You can see the white color dress, personal protective equipment, PPE should be there. Otherwise, skin allergy or body contact with this disinfected powder or alcohol based solutions may cause some problem with that. Okay, so IoT, we are coming to the last part of this presentation. I'll quickly go through. And the history of IoT, I'm just using the picture from 1990s. Internet of people are there. The devices which are connected with internet is very less in 1990s to 2010s. From 2010 to 2020s, you can find Internet of Things. From Internet of People, we are migrating to Internet of Things. See the number of devices. Tens of billions. The number of devices are increasing like anything. So the devices which are connected with the internet are going like anything. The exponential increase you can find from 2010 to 2020, last year, till last year, tens of millions, billions of devices have been connected across the globe with internet. That is the current scenario. There are many definitions are given, okay, from Wikipedia. And we have very important summit that is called World Summit Information Society. They have come up with their own definition for Internet of Things. And we have IoT 2008, the conference or symposium, IoT in 2020. So finally, we can conclude that, okay. And you have everything in the real world, the physical objects, they're all connected with internet, and they are able to talk. Okay, it's no more human to human talk, the object to object talk. That is what we are talking about. It can be used in societal or environmental or user context, okay, with various interfaces, so that your office becomes smart, your college becomes smart, and your environment becomes smart environment, and so on. The driver of IoT connectivity you can find, it starts with satellite, very big coverage, okay, universal level. Cellular, the greater range is there, but not up to the satellite. And Wi-Fi is there within the campus or within the local area. And you can find small dots is there. And finally, you can find Bluetooth, Zigbee, and Ant is there. Ant is a company which is developing audio devices, but here it is very popular. Multicast wireless sensor network, that is a popular name. I don't know, it may be new to you. So you can find the greater range and least power consumption. When you go to the right hand side, the small circle is there. Okay, they're all helping us. Okay, the driver of IoT connectivity, so any physical object can be connected. So finally we can conclude what is the definition. So any person can connect with anyone in the world, with at any time, at any place. That is exactly, it is no more any person, actually anything in the world. That is called Internet of Things. So anything means it includes a human, it includes your mouse, it includes your mobile, it includes your lap or tab, or anything, your watch or whatever it is. So anything can be connected at any time to anything, okay, at any place. So this kind of connectivity we can find, okay, when I'm walking, I must be able to connect with my mom. And when I am in an indoor sports stadium, when I am in my night, okay, and daytime, on the move, outdoors, when I connected with PC, when I was not connected with PC, okay, human to human, not using PC, between computers, human to think can be anything, think to think. A pencil is connecting with camera, or a pen is connecting with a camera, something like that. This is exactly Internet of Things. So human beings versus interconnected devices, you can find 2020, the internet connections, okay, that is internet connected device, it is going very high than the human connection. This is taken from Cisco. They have come up with this analysis. Okay, the internet connected devices are increasing like anything. It's up to last year, it is given here. So the perspective of IT, students' point of view, wireless connectivity, app development, cloud-based software, sensor advancements, microcontroller, Arduino or Raspberry Pi. And here you can find that humans in 2020, 7.6 billion, devices are 50 billions. That is the IoT perspective we are living today. And whatever things, okay, sensors are going to sense something about temperature or pressure or heart rate, whatever is the motion or vibration, finally what we want to achieve, okay, benefit to the society, humanity. This is more important. So your data should be converted into information, then knowledge and wisdom. This is what we want to transform the data, okay, from human point of view. And this is what given here: device collection, IoT devices, data sensing, capture the data from the surrounding environment, think about storage, think about communicating with other networks, cloud, and so on. Data analytics, we have to make some decisions, find out the data value, make analysis into action, and make sure that it should reduce the cost and give more profit or more benefit to the users. So Internet of Things from connection to benefit. That is what connecting devices to human value is discussing. So for medical field is concerned, it is used to fight against the outbreak, data collection, ensuring the compliance, manage the patient care, monitoring. You need not go to the particular COVID-19 patient, central monitoring, reduce the workload of the people, and less exposure to the COVID affected patients. That is what we are using COVID-19. I have come up with fourth part, IoT and cloud-based screening system. Okay, and it says that error-free online screening and tracking system for COVID-19 patients. It can be used in malls, railway stations, bus stands or hospitals or residential complexes or big apartments, temples, and any other areas. This is very popular system. We have it today, IoT and cloud-based screening system. So how it says, it uses infrared radiation phenomena. It can detect and simultaneously alert authorities. It's just going to screen the human, whether he's having a fever or not from a distance. And this solution, okay, infrared radiation based solution is integrated with some mobile app. So that this mobile app, it's trying to record the temperature, symptoms, travel history, medical history of the people which are being screened. Okay, and further investigation we have to think, so it should be reported to the particular authorities. They may be the hospitals or government agencies, the health department. So here we are going to make use of IR sensor, Wi-Fi, Bluetooth, mobile app, cloud storage, and built-in battery backup for this system. So this system is working like this. Person being screened apart from some distance, an operator is there for this IoT and cloud-based COVID-19 screening system. What kind of communication we are going to use, a short range or Wi-Fi network, and mobile sync via Bluetooth or Wi-Fi and remote data. This is the system we are currently using. Not only getting the patient data, we can make some analysis. We can find out some value, wisdom. See here, a day-wise scan status, high temperature scan record, details of person having abnormal temperature, location or device-wise reporting, okay, univer place, okay, where it is being recorded, analysis of records, interactive dashboard by involving the physicians, lock or unlock any device from admin panel, that is asset control I was talking about. All these things we can do. So with the help of IoT and cloud-based system, IR sensor is there, humanless operation, historical data can be maintained, okay, and cloud data storage, mobile app is there, GPS tracking of flu suspect in particular region, author linkage can be given, government data linkage, all these things can be incorporated together. So there are other challenges also, okay. Today I think you might be knowing that there may be in none of the hospitals, if you say regular checkup for heart problem or any other issues, okay, diabeticians, okay, what the hospital will do, please continue this medicine for a month, take an appointment through phone calls or video calls and try to take the medicine. This is called teleconsulting, because there are no beds, okay. They are not allowing the what is that casualty, that is not functioning because of COVID-19 in all hospitals, okay. Normal patients are not allowed to come to the hospitals. So here, white coat, there is an app, HiDoc, Doctor Anywhere, Unsang, there are popular apps are already available for COVID-19, okay, so that you can have teleconsult and tele-rehab using video consulting with your own doctor with 24/7. And that is what happening. Most of the countries, 58% of countries, they moved into this particular healthcare space. And not only that, I think some of you may be going to the what is that, gym, or they may be trying to go for yoga classes in the evening. But what is the problem? You're not allowed to go to the gym now. It is not allowed. So how will you maintain the fitness? We have a system. Okay, these challenges are addressed. Okay, fitness workouts. There are many gamification is there already that can be shared with you. Online yoga classes, online gym, okay, instructor is giving, coach is giving some instructions to you in online. So something like that. So people are finding out. And this is a one good example I found that I request the students to think about UG or PG students or the faculty members who can give this idea as a project to our students, which says that, can I develop an app which may connect my relatives or which may connect my neighbors? Imagine, okay? So your neighbor may need some help, but they don't know how to contact you, something, for an example I am telling. So through which you can request help or offer the help, and you can give something, receive something, or you can exchange something, okay? So normally in this period, we are just thinking about the services to us, okay? A kind of self. But in Singapore, they have come up with some idea that is called as the Goodhood SG. SG stands for Singapore. Okay, so which can connect your neighbors with you, and you can extend services to your neighbors. Okay, already some apps are there in India. Okay, so finally I can summarize the benefits. Reduced chances of mistakes, lesser expenses, enhanced diagnosis, effective diagnosis, superior treatment, satisfaction to the patients, home care, cloud storage, better patient experience, all these things you can achieve. I think I already talked about remote health monitoring, robot assistance, digital diagnostics, telehealth consultations. I'm just skipping this slide. So coming back at the end, Industry 4.0, it says that Industry 4.0, please understand, okay, this is very popular technology. This is the current trend. People are talking about Industry 4.0. That is the fourth revolution for industries, okay? That is what people are talking about. See here, the very first one, robotic process automation to support non-value and labor-intensive activities. See here, 3 hours a labor should do something on the patient, COVID-19 patient. Already Italy and US, France, they have already used Industry 4.0 technology for combating COVID-19. That is called robotic process automation. And we have augmented and virtual reality to enable the workers to perform tasks even though they have not trained already how to handle the COVID-19 patients. But with the help of augmented and virtual reality, okay, you can come up with this some solutions to help them out, especially the physicians and medical support staff and the health department people. And we have digital twin technique, remote support technique, and 3D printing. Okay, I found that Industry 4.0 technology is helping the hospitals in Italy, because most of the people affected in Italy and they are elderly people. When coronavirus wave 1, okay, was striking European countries, and here you can find 3D printing like AR, VR, digital twin, and robotic process automation. 3D printing is also very interesting technology which comes under Industry 4.0, which says that Italian hospital saves COVID-19 patients' lives thanks to 3D printed walls. Okay, imagine so many help we are getting from Industry 4.0 technology. I think summary, I already said that sensors are really helping a lot during this pandemic time. We know that the outbreak changed the perceptions of Internet of Things is totally changed. People thought that IoT can be used for certain applications, but today it changed the perceptions because of this outbreak. Okay, and remote diagnosis, good treatment to the patients, and how you can deliver the medical equipment and medicine to the isolated villages or towns with the help of IoT and blockchain. And all these things are given here, really helpful for every one of us. And this is what I'm going to end. Okay, within few minutes we are going to end. Thanks for your patience. So finally we can say that IoT and COVID-19, in the left hand side you can find IoT and work from home, IoT and blockchain, IoT and e-commerce, IoT and telemedicine. This is what happening in our surroundings. Okay, that is okay. So everywhere people are saying that outbreak, stay home, lockdown, something like that, pandemic, these are the words are used, okay, everywhere we are finding. As a student, what we are supposed to do, that is what I said. I have a surprise for you. As a student, what I'm supposed to do, I request the students of King's College or from other colleges or faculty from same college, KCE or other colleges, to encourage the students and to go for some certifications related to the current technology, the online courses. That is what. So since people are, the current trend is industrial IoT, there is from Coursera a free course for the students related to our talk today, industrial IoT markets and security. Okay, it's going to start from May 31. I just collected so that from students what they will expect. I thought that the certifications, it's a need of the hour during this pandemic time. It's a very tough time, but we have to build our skills through online courses from top institutions. You must be knowing that Coursera is actually developed by professors in Stanford University of United States. They have come up with this idea. It's really helpful. I have done some courses. It was very tough, okay, but it was interesting. So you can think about doing some online courses, relevant, not relevant to IoT. You can think about many online courses are there. Then developing industrial Internet of Things specialization. There is another course from Coursera, from the same professor. It is also available as free. You have to register and please go through the syllabus if you are interested. And we have another interesting Coursera that is called Industrial IoT on Google Cloud Platform. Okay, I already done some courses in Google and Microsoft Research. and they are very tough courses actually, not relevant to this platform, but you can register at any time. Okay, already 70,000 odd people have registered with Google Cloud Platform Industrial IoT. Then Udemy is another popular. Some of you might be knowing that, okay, because third year students and final year students, they can think digital transformation and industry 4.0. That is what I addressed in my talk. You can think about that. And then complete beginner's guide to industry 4.0, which involves robotics, IoT, AR, VR, digital twin, remote monitoring, so 3D printing. There are so many things are covered. Industry 4.0 learning essentials, same Udemy. Learn anything on your schedule. Fundamentals of Industry 4.0, it is also there. And in India, we have NPTEL. You might be knowing that. Okay, MOOCs platform, Swayam. I think all the colleges, we have been encouraged, because most of the topics I discussed with you, the courses, online courses for students' point of view, it is based on Industry 4.0 because it is the current trend. People in IITs, IICs, they are thinking about developing or designing Industry 4.0 lab for their own campuses. Okay, that is what the trend is going on in IITs and other foreign universities. So therefore I talked about more courses on NPTEL in Coursera and Udemy. And here NPTEL, because being an affiliated institution, we have our own limitations, and NPTEL courses are there. Introduction to the Internet of Things is there. IIT Kharagpur, Introduction to Industry 4.0 and Industrial Internet of Things, that is IIoT, 12 weeks course, 4 hours per week, IIT Kharagpur. Cloud computing, relevant to our domain, track. At the top, you can find Internet of Things. We have 5 courses currently in NPTEL. Please go through Introduction to Blockchain Technology and Applications, Google Cloud Computing Fundamentals. These are the courses are also there for you to think about and take some relevant courses according to your area of interest. And over to questions. I think I have exceeded few minutes. Okay, 20 minutes more I have exceeded because I was going through the slide once again. I'm sorry for that. Okay, it is open now to the question sessions. I'm very sorry for the delay because 1 hour 20 minutes I have extended already. Sorry for it. Yeah.
Sir, I have a question regarding COVID-19. Could I?
Yeah, please. What's your name?
Gayatri, sir.
Yeah.
Sir, some of them telling that too much of using sanitizer get risk to fungal diseases.
Yes.
Is it possible?
Yeah. Yes, it is also there. Yeah, I agree with you. Okay, so we have to select the proper hand sanitizer because there are a number of hand sanitizer from all the companies, Hindustan Lever, every company they have come up with. Okay, so we have to check, even though it says that it kills 99.99% of germs and bacteria without water. Okay, and we have to find out a good hand sanitizer. Normally it won't be so watery according to my observation. Okay, but most of things, it gives good smell. I found that I don't want to name the brands, okay, because this is the public forum and I don't want to name it, but your point is very valid. Okay, we have to be careful in choosing the proper hand sanitizer. Okay, because it's in different color, different fragrance, all these things are there. Many herbal hand sanitizers are also there. I totally agree with you. In certain people, they are saying that they have some skin allergy, but we have to be careful in choosing the appropriate hand sanitizer. That is my suggestion. But your point is very, very valid. Okay, so we are using hand sanitizer with a proper choice. That is what I can tell you. Okay, so we cannot make a survey. Okay, which hand because alcohol, it should be little thick. That is what I feel. So okay, but anyway, it's a good question. Yeah, Gayatri, I think so. Am I right? Yeah.
Yes, sir. Thank you, sir.
Yeah. We have reports. Okay, we have the reports, but I should not use any brand name here. Okay, therefore, in general, I am telling. Yeah.
Sir, there is a question from through YouTube chat box.
Yeah, please tell me, Ma.
Is there any new technology adapted in educational field now other than Moodle?
Other than Moodle, am I right?
Yes, sir.
Any other new technology, we are all using Moodle, but people are using the terminology called MOOCs, okay, for online classes. NPTEL is concerned. I think Moodle is doing a good job for education. That is what I can tell you. Moodle is doing the good job. Okay, but it should be linked. What I can tell you, the Microsoft Teams, okay, Microsoft Teams have come up with maybe in order to address the query, okay, other than the Moodle, because Moodle will be putting some lecture materials, some past or previous question papers, or some lab manual or some assignment, something like that. In addition to that, okay, we have certain things with Microsoft Teams. Okay, so I think people are switching over to Microsoft Teams, where you can integrate the Moodle with Microsoft Teams. So that can be the answer I can give it to you. Okay, so in terms of education, the new technology, that is what the question asked by the participant through YouTube. Okay, I can tell you that with Moodle alone, we cannot proceed. I agree. Okay, so we can integrate Moodle with the online platforms. Okay, and like Microsoft Teams. Okay, that will do the wonders. I think we already tried and it is going very well. We can integrate Moodle with other platforms. Then it will be very much interesting. Yeah, definitely. Moodle alone we cannot go ahead, okay, because there are certain limitations are there. We have to club with Teams and other things. Yeah, that is my view.
So
Yeah,
we have one more question.
yeah, please.
What about the role of IoT in the field of biomedical or the patient's emotion analysis, sir?
Yeah, that is true. We are actually, I'm going to start a project. Okay, so I think that is a really an interesting question to me. So the role of IoT in biomedical, it's huge. Okay, so already we are working on a project.
Sir, and one more question from myself. As
Mm,
sensors are the vital input to the IoT,
what? I'm sorry. I didn't get. I'm sorry. I didn't get your question. Please repeat again. Excuse me. Can you
So
hear?
sorry for the interruption. You can
Yeah.
continue.
Yeah. Okay. Yeah, the role of IoT in biomedical, it's huge. Okay, so the current research work we are doing is on the chest X-ray images, okay, and which was already collected, okay, which was already collected. Some research is going on, but using IoT, how do you integrate using IoT in biomedical? As we discussed, it can be the health monitoring. I think we already discussed that is related. There are a number of instruments are already available, IoT instruments or equipments. I just forgot the name here to mention. Okay, there are many instruments are there. I just forgot few names. Okay, definitely it's playing the major role. Maybe if they ask through the mails, okay, I can give some inputs to them if they are very particular. Okay, the instruments where IoT is playing the major role. Okay, so definitely there are many things over there. I can share some information through email if they contact. Yeah, okay.
Thank you, sir.
Thank you. Yeah,
Sir, here a vote of thanks.
yeah.
Thanking is one of the good manner to keep ourselves and others to proud. Now, I would like to welcome Ms. Lachya Sri from 3rd ECE to deliver vote of thanks.
a warm and cherished greeting to our most valued Honorable Chief Guest, Dr. Jill Lewis Paul, Sir, Management Committee, Honorable Principal, respected Vice Principal, beloved HODs, and most valuable staff members, my dear friends and friends from other colleges. It's my privilege to propose a vote of thanks and acknowledge the contribution of those who worked for this webinar. On behalf of Electronics Club, I would like to extend a warm and the entire fraternity of the Institute, I, Jesse from 3rd ECE, give a really heartfelt vote of thanks to our chief guest, who spends his most worthful time gracing the occasion. Today we had the opportunity to hear our thoughts, and this definitely made sense, sir. I also want to thank the staff members who worked behind for the technical arrangements. I hope all will stay home and safe, and let's contribute to the break the chain of COVID-19. Thank you all.
Yeah, I would like to thank. Can I do, Mr. Newton or Mr. Nil? Yeah,
Yes, sir. Yes, sir.
yeah. I would like to thank our, I think, Principal Madam, um, Dr. J. Arpuda Vijay Selvi, ma'am. Thank you, ma'am. And I would like to thank the HOD of the department ECE. I think Madam Mangirkarsi. Thank you very much, ma'am. And I'm very much thankful to Mr. Newton, sir, and Mr. Niranjan, sir, for coordinating and giving this opportunity for the first time to interact with King's College of Engineering. And I must be thankful to the people, Gayatri and other people, okay? So, Kirtika, and so on. Okay, so I'm very much thankful to you for coordinating this event along with your faculty. So thank you so much for the great opportunity given to me. Thank you so much. Yeah, thank you all the participants for your patience. I extend